Dr. Christine Lay from Kelsey Sibo, and we're just going to ask you some questions about the coronavirus and the questions that a lot of people are asking us. So we're just going to get right into it. The first question is the coronavirus airborne?
Yes, absolutely. It's spread through the air, and it can actually spread 6 feet. And so it's definitely very important to stay 6 feet away from other people.
Okay, because a lot of people have been asking us that question. Also, how do you know if you have the coronavirus?
The only way to know for sure is to get testing, and it's definitely rolling out as we speak, but this is very fluid, meaning I don't have the exact numbers. It's usually still with teamwork at the health department, but talking with your doctors or healthcare providers clinic, like Kelsey Siebel, we work with the health department to determine which people may need testing, and we sort of help patients through that process.
Okay. And a lot of people ask, can I get the virus when I'm exchanging money?
It's very unlikely. It only stays on perhaps hard surfaces for about 3 days or so. So it's unlikely that money or books would keep the virus there.
Okay. Also, what about if you're getting your groceries delivered? A lot of people are wondering that because a lot of people can't go actually physically go to the grocery store. So if they're getting their groceries delivered, they are afraid that they could catch it through that.
Remember, it's airborne, and it's also, for example, through sneezing or coughing. And so, what some experts have recommended is if you're buying to go or from the grocery store, what you could do is you could take it out of the packaging, and that should be fine.
Okay.
And take it out of the bags would be fine also. Wash your fruits and veggies.
Can I go to the doctor and request a coronavirus test?
OMG, we have been getting this all day long. It's almost like they think they can go to, like, they can just stop by and just get a corona test to go. So really, very important to know that the testing is limited. It is rolling out. It is still through the health department, and so. Along with your doctor's office, like Kelsey Siebold or the Harris Health, they can determine if you need the test, and they can let you know where and how to get testing.
Okay. And also, is it covered through my insurance?
At this time, it sounds like what the government is trying to do is to make it fully covered for everybody.
Okay. What is the recovery rate of the virus, and is it killing most of the people it infects?
That is a tough question because a lot of our data is not in the US. And so we can hear information from Italy or Japan, but we have so many different ages and people from all over the world who come here. And so we don't know yet because the testing is coming along. But it looks like it can be about maybe 90%, 95% of people after they get sick generally do fine.
Okay. What do you see this situation looking like? A month from now, 2 months from now, or 3 months from now?
Okay, that is hard to predict. No one can answer that at this time. We are at the tipping point, though. This is super duper important, especially for all those millennials. We really need to socially distance. I mean, you can definitely reach out and text someone or call someone, but we don't want you to touch anybody at this time. And we really need to follow what our government and the CDC and our health department tell us so we can stay away from harm.
Right. Okay. And so, how do you feel about the millennials who are going out and purchasing the really low airline tickets despite everything that's going on?
It's a little bit rough because we don't know how sick they can get. If you look at the stats in France, though, there are actually a lot of young people who are getting sick also. And so what we're really looking at is it means like everybody has to be grounded. We really need to stay at home and stay 6 feet socially distant from everyone else. We can go to the grocery store. We can chill out at home. The CDC says you can actually hang out with 50 people if you want. Although the president actually said we should hang out with only 10 people or less. And so, we can still be social, but a more intimate circle.
Okay. Okay. If a person may have been infected by the coronavirus, what are some of the first symptoms that they will start to see?
So, what we're looking at, which is sort of interesting with this virus, is that we think that people can infect other people a couple of days before they get sick. And so, that's the whole reason for having the kids stay home from school. That's the whole reason for closing the bars down and having the restaurants only for to go. So, we really need to keep people at home. And in terms of getting sick, oftentimes if a person does get sick, it may initially feel like a cold. You know, you may get a stuffy nose or runny nose, fevers, a little bit of cough here and there. But then for some people, it can progress and people can really have difficulty breathing and require medical assistance.
Okay. Is this virus a lot like the flu?
I would say that they are alike in terms of it is airborne. They're both airborne, but this is a new virus. It even has a new name. And so we're just learning information every day. It's so fluid. No one has all the answers at this time. What we do know is that it can affect anybody and it can get people really ill. And we're at the tipping point because if people are not following what the CDC and what Harris Health and what our president says, we could get a whole lot of people sick and wind up in the hospital. And unfortunately, for some people, they've actually died from it too.
One person said, my baby woke up with a fever and a pink eye. I feel like it's viral, but I'm also afraid to take him to the doctor to get tested. I don't want him catching the virus. So what do you think
That
that
is
parents should do?
that is a really good question because people are scared to go to doctor's offices, and I totally agree. And clinics that include Kelsey Siebel, we have all this virtual visits that's available. We have e-visits, we have video visits, and we're starting with phone call visits. And so, really, you can get the care that you need but not step into a doctor's office. I mean, look, I mean, we're in Houston. We have NASA close by. If the astronauts can use virtual visits, why can't we?
People are asking about pregnancy and where the risk stands in that case.
So far, it looks like Harris Health has deemed that pregnant women may be at a much higher risk than all the other groups, which include people above age 60 and other people who may have heart problems, diabetes, asthma, cholesterol, high liver enzymes, kidney issues. And so some of these things are also silent, which is very important because some of these millennials don't know. They may have some health concerns that they didn't know about. And this coronavirus could get them sick very easily.
Okay, so do you believe that pregnant women are at a higher risk of catching the virus?
And pregnant women, remember, they actually are taken care of too, yes? And so we do know that a woman who's pregnant, her immune system is not going to fight infections as much as a person who only has one immune system.
Right. So we're going to bring over anchor Chauncey Glover. He just has a few questions that he wants to ask. So we're going to bring him over so he can ask you a few questions as well.
Hey, Doctor.
Hello.
Good afternoon.
How are
Good
you?
evening now, rather. I'm well, thanks. How are you? Listen,
Very good,
so
thank
quick
you.
question. Now the number here in our area is at 36. When you take a look at
see.
some of those other places where they've been a hotbed, and I know it's hard to like pinpoint, but do you see, as we go by the days and the weeks, do you see that number growing here in our area? Because I remember when we first started reporting, it was like, oh, we have 2 presumptive cases and 1 case here, and now it's all the way up to 36. What do you project as we get these tests done? We just opened up our first drive-through testing here in Houston. Where do you see the numbers going, Doctor?
Well, we definitely expect for the numbers to increase, and we definitely trying to roll out the testing as quick as possible because it's important for people to know if they do test positive because they really need to self-quarantine and also be careful because some people who have it can get very sick very easily. So I'm expecting that all the states that are doing testing to have their numbers increase. But it's very difficult for us to know because it's been a very super slow process for Americans.
Yeah.
And you know that everyone wanted to get tested like weeks ago, and we're finally having it roll out now. But I do want to reassure people that the testing is coming, but it's very fluid, and so we don't know how many tests we're going to have, but it's definitely coming.
Gotcha. And what do you say to those people out there? I was on Facebook and Twitter earlier, and they're saying I don't. People are saying I don't have any symptoms, but I am concerned. I want to go get tests. I want to go get tested. I feel like I should have a test. I haven't traveled. What should I do? And I've seen both ends where some people say I am showing symptoms, but I haven't been out of the country, I haven't traveled, I called my doctor, and I don't know what to do. It's hard to get a test now. What should those people do?
Well, remember that the testing is rolling out, and at this time, it's really with each health department. And so, if they contact the doctor's office, like our patients will contact us, and we triage them, and then through their answers, we contact the health department on their behalf, and then they're the ones who determine who gets the testing. But obviously, a person who, let's say, has gone to a country with corona, just hopped off the plane, has fevers, shortness of breath, was with a family member who tested positive, certain people are going to have to be at higher priority than a person who doesn't have any symptoms. We're definitely going to have to ration the tests because at this time it's not available to everybody. But I definitely I understand that people are concerned, but we definitely need to get the people who are at highest risk and with symptoms tested first. And at this time, it's still with the health department that determines that.
And that was my next question, doctor. Does each hospital or each medical group or each clinic have its own process of how they're responding to their patients and getting their patients possibly tested? So I know you say your patients contact you all, you do a triage, and then you all contact the health department on behalf of the patient. Is that how most hospitals are doing it, or is it left up to the provider?
Actually, I think what happens is the government actually has to authorize the testing facilities, and so that's why we're sort of very slow because all of them have to make sure that the test is accurate. I mean, who wants to get a test if it's not accurate? And so that's why they've been a little bit slower to pull the tests out, and we really need to leave it to the health department to make sure that the tests we get are accurate and that the testing facilities will give good and accurate results.
Gotcha.
Also.
And when it comes to corporations and businesses who they just have to stay in business, they have to have their people there, just like one of our Facebook followers, Carly Mazur, she says, what is your advice for those of us who still have to go into our corporate offices of 1,000 and employees plus? My company is demanding we take PTO if we do not come in. What do you say to those people who are concerned but still have to go and earn a paycheck and don't want their jobs to be affected?
Well, it's a tough situation that we're in right now. And for any people who have to go to work but are sick, though, it's so important that they self-quarantine at home and they talk to their work about their home situation. And for the other people who actually feel fine but they have to go to work, what we're still recommending is the social distancing of 6 feet. I'm sorry, but no eating with your coworkers, maybe hiding in your office, bringing your own lunch, going straight from work to home. But every situation is so different, and I know it's really tough on mostly everybody in the U.S. at this time, and especially Houstonians who we've had to deal with many things, right? We've had to deal with floods, we had to deal with boiling water, and now we're having to deal with coronavirus. But I want to reassure people that we are so Houston strong. We are Team Houston.
Hey, Chris.
We will get through this
together.
Doctor, but 6 feet apart, though.
All right. Hey, Chris, I've got to get on set. Can someone finish this? Yeah. One more question. I've got to get on set to do the 6:30, doctor. But as those tests begin to roll out starting today, where do you see the peak in this? When do we see a major curve in the slowdown of seeing these cases and not so much a pandemic anymore?
Well, we are definitely trying to flatten the curve, and the best way to do that at this time is to hunker down, stay home, and stay socially distant at 6 feet. We don't know yet. It is so fluid, but really the most important is try to stay home if possible, and 6 feet apart is the best.
Thank you so much for talking with us. If you just want to introduce yourself to everyone who may have came in a little later.
Sure. Hello there. My name is Dr. Christine Lay. I'm one of the family physicians at Kelsey Siebel. And definitely for everyone who's concerned about their health, Kelsey Siebold has so many options for you to not see the doctor and get good care, because we have e-visits, we have virtual visits with video, and we're actually rolling out our telephone visits. And so we are happy to see you anytime that you need us. You can contact us 24/7.
Thank you so much for talking with us.
Have a great
You
time.
too.
Okay, take care.
You
Be
too.
safe.
You too. Bye.
Bye.